Welcome to Heart Nurses, brought to you by the Preventive Cardiovascular Nurses Association. PCNA's mission is to promote nurses as leaders in cardiovascular disease prevention and management.
I'd like to welcome our podcast audience back to this episode of Heart to Heart Nurses. We are really grateful to our two guests for joining us today, and I'm going to let them introduce yourself. Cindy, I'm going to go ahead and start with you.
Hi, I'm Cindy Lamendola, Geraldine, and I'm very happy to be here to talk about these wonderful new weight loss drugs. I'm a nurse practitioner at Stanford University and Stanford Healthcare, working both in clinical practice and in research. And I've done a lot of research on insulin resistance and weight loss and obesity and all those things that we know the risk factors, the cardiovascular risk factors, can be affected greatly with weight gain and with weight loss.
Excellent. Well, we look forward to our conversation with you. Sheila, could you share a little bit about yourself with our audience?
I'm Sheila Allen, and thanks for having me. I am a retired social worker. I live here in Central Florida. Grandmother, mom, great-grandma.
All the good things in life.
Yes, all the stuff that I've been waiting for. And I'm also a woman that's living with heart disease. So.
Excellent. Well, as our audience can probably tell, we have some great perspectives at the table today. So Cindy, I'm hoping you can start us off by just kind of recapping for us what kind of pharmacotherapies are available for weight loss. And obviously there's a lot of new players in that field.
There's some new players, Geraldine, and they are very, very exciting. So this is going to be a new time in terms of our risk reduction for cardiovascular or cardiometabolic disease. And like other things, like when statins first came out or when the ACE inhibitors first came out, I think it will be a monumental time now. It's very, very exciting. These are very effective medications, in general, very well tolerated, and with great benefits both for weight loss, for type 2 diabetes, and for just decreasing cardiovascular risk. They're phenomenal.
Well, with that perspective in mind, Sheila, I know that some of these drugs have been recently introduced to you, and you've been taking some of these for a while. Why don't you tell us a little bit about your experience?
Because of my situation and my diagnosis of heart failure, I had been told over the years, lose some weight, go to the doctor. I want you to lose 20 pounds. No, okay, lose 20 pounds, but I kept gaining weight. So at the beginning of last year, I had got to over 300 pounds. And I started to have the conversation with my primary care doctor that I had been reading about the GLP-1s and the weight loss drugs and wanted to know what he thought about it. And he said, well, let's talk about it in a month or so. A month went by, and I went back and asked him again, and he asked me how would I feel about trying it, and I said, I'm open to doing that. And he said, well, we're going to consult with your cardiologist first, and they did. They had a consult and they talked, gave me the prescription. Could not get the drug because of insurance, and I was not diabetic, and I was not, even though he tried, then he go, we'll insurance company said, we don't cover that one, but we'll cover this one. And he wrote the prescription for that one, and they said no. And he said, we'll have the cardiologist to write the prescription. The cardiologist wrote it, followed up with all of the questions they had. Insurance company still said no. So months are going by. Summer came and went, and I came across actually a nurse in my endocrinologist's office was in contact with a nurse that was working in a weight loss and nutrition practice, and they referred me there. And that's how I started receiving the drug in August of last year, late August.
So sometimes, even though you feel like all your ducks are in a row, you think you're ready to roll with the prescription, you're committed to taking it. Sometimes it can be rather a challenge to get that. So I'm sure that's very frustrating. Obviously, from your perspective, you waited months in order to get this to happen. Are there any strategies, Cindy, that you might provide for our providers who might be listening in terms of things that might be helpful for them if they're working with patients like Sheila who might not fit those exact standards, or that, you know, they do a prior authorization if such a thing is required for any drug? I mean, what are some ways that we can help our patients even more?
I think because the couple of drugs that are out now have completed studies and have gotten FDA approval for weight loss. So now they have a designation for weight loss for people who fit the criteria for overweight or obesity. With diabetes, without diabetes, we are going to have a little bit more success. So that's number one. So when you can say, because they just used to say no, she went to 4 different people, they said no, and we've had that same problem where you submit all your paperwork, you've even submitted that the person's gone to a dietitian, whatever, and they still would say no. Now they're not going to be able to say no because these drugs have been appropriated for weight loss. Having said that, they're also very expensive. So some people can maybe get the drug, but their insurance won't pay for any of it, or even if they pay for some of it, the copay can be $260 or more. And people that pay out of pocket because they can pay anywhere from $600 to $900 a month. So Medicare's been approved to pay for it. I did have a patient who was on Medi-Cal or Medicaid, and they have no copay. So we're getting there, but it's going to take a while. And with more competition, with more drugs coming in, it'll also with the competition will force the costs going down.
Great. We're going to take a quick break and we will be right back.
For more education, resources, and tools for your clinical practice, visit pcna.net. You'll find CE courses, patient handouts, and more, all free to access. Visit pcna.net.
We are so excited to continue our conversation about new and up-and-coming kinds of therapies for our patients who are obese or are overweight, and the benefits that we're seeing. And so, Cindy, could you talk a little bit about how this works in practice?
Yes, in practice, this is just fabulous for many things. So we know maybe when we're on these drugs, they might be long-term, and people are questioning that. But we also know that this is a disease entity. And just like hypertension, we keep patients on those drugs because if we take them off, their blood pressure will go up. So with these drugs, we are going to get a reduction in blood pressure, obviously a reduction in weight. People will feel better, as you'll hear a little bit more about it. But we also will have not only a loss of fat mass, but some muscle mass. So it is really important to incorporate lifestyle, and that's seen with seeing a nutritionist, a dietitian, or a program like Weight Watchers to make sure the person is eating healthy, enough of the important nutrients, protein, to make sure we're not losing too much muscle, and also to incorporate both aerobic and weight-bearing exercises.
So how has this looked for you, Sheila, in practice as a patient with heart failure?
Well, when I started on the medication, the nurse practitioner, she was also she had me with a nutritionist, and she laid out a program for me to do some moderate exercise at first, and we did login of what I was eating, and she stressed the importance of the diet and drinking fluids and water, staying hydrated. And I think that those things together has made it successful for me, and I've had over like 40-pound weight loss in the last, what do we say it was, 6 months, 8 months. And I feel fine. I feel, actually I feel better. When after like the 3 months, 4 months, I went in and saw my primary care, and he goes, "Hey, how you doing? You look good. Your knee's not hurting anymore." And I'm like, "Exactly." So it's worked for me all around.
Fantastic. Is there anything else that either of you would like to add that we haven't had a chance to discuss already?
I would say just give it a chance and make sure that you follow the lifestyle and the diet changes and consult with your medical team. That's what's been successful for me.
Cindy, this is a great example of shared decision-making in action, is it not?
Yes, it is. Yes, it is. And I think people are very excited about the opportunity. I think they're also very excited to have that stigma of it's not my fault type of thing taken away from them. So this is a wonderful win-win situation that we have not had the opportunity to do forever. And so, like I said, these are phenomenal medications. We're looking forward to new ones that come out, and we're looking forward to a plentiful amount of medications that we can give to our patients at a lower cost. All that in one swoop.
Yeah.
I love that. Thank you both so very much for spending time with us today. This is your host, Geraldine Warfield, and we will see you next time.
Thank you for listening to Heart Nurses. We invite you to visit pcna.net for clinical resources, continuing education, and much more.